picked up from Scientific American website as well, and it says that out of every 5 COVID-19 patients, one is dying because of a cardiovascular disease. Now there's this question whether COVID-19 is having an impact on the heart and the lungs, because so far what we have known is that we have only been talking about getting more ventilators so that people can breathe, and we know that COVID-19 is actually a kind of virus which impacts on your lungs too as well. But that's not certainly the case. So ladies and gentlemen, we need to ask about that as well. And not just that, we're very lucky that we've actually been joined by somebody who takes responsibility over here in Islamabad as per the health requirements. And we will be asking him whether how many beds do we have for COVID-19 patients, how are we actually taking people into quarantines as well, or probably isolation centers, how many isolation centers we have, how many ventilators we have. So we'll be asking all of these questions. And if there's anything anybody wants to ask, all you have to do is that you have to write to us on our Facebook page, which is with the name of All This Morning, and we'll get it answered as well. So ladies and gentlemen, without any further ado, getting started with my conversation. We're very lucky. This gentleman, ladies and gentlemen, we have been friends. I mean, that's how I would like to put it. Obviously, he's a very senior. He's one of those people who've mentored a million other doctors as well. But whenever I see him, I always praise him for the kind of dressing he does. And, you know, whenever you'll see him, he'll always be wearing some slick suits as well. Ladies and gentlemen, he's a consultant international cardiologist. He's none other than Professor Dr. Amjad Bhatt Sahab. Hello, sir. Assalamu alaikum. Good morning.
Wa alaikum assalam. Thank you. Good
Thank
morning.
you very much for joining us, and you look handsome once again.
Thank you again.
Alhamdulillah.
Thank you.
You know,
You've been very
you're always on point. Always on
You've
point.
been very
Alhamdulillah.
kind.
Thank you very much for joining us. And alongside Professor Saab, ladies and gentlemen, we're very lucky that we've actually been joined by the Deputy DG Health Islamabad as well. He's none other than Dr. Minhaj Siraj. Hello, sir. Assalamu alaikum. How are you?
Walaikum assalam. I'm fine. Thank you.
Thank you very much for joining us. It's wonderful to have you. But before I move on to WhatsApp over here, you know, there's these questions which everybody needs to ask. And let me ask you, let me put it this way. So, sir, first of all, what I want to know is, what is the total population of Islamabad?
Islamabad has a population of about 22 lakh people.
20, so roughly 2.2 million people. And if I am supposed to ask you, how many ventilators do we have in all of those hospitals which are treating patients with COVID-19? So what's the number?
Basically, in the federal government hospitals and the major private hospitals of the city, we have total number of about 54 ventilators which are functional.
Which are functional. Yep. And then we do have more ventilators coming in as well.
Yep, we are in the process of, we have procured them, and they are about to reach Islamabad, and then they will be distributed among the most.
Well, that's great. So we're working in the right direction. And then, sir, how many hospitals are treating patients with COVID-19, and what are the precautions taken by the hospitals themselves to make sure that the disease itself does not spread around in the hospital?
The basic major 3 hospitals of the city, that is Pakistan Institute of Medical Sciences, Federal Government Polyclinic, and Federal General Hospital, they are entertaining the patients who come with the symptoms of COVID or flu-like symptoms. The basic precaution what we have taken at the hospitals is that we have closed down their outdoor clinics.
All right.
At the moment, we are not entertaining the routine walk-in patients.
All right.
So the overcrowding is avoided. And then, of course, we have dedicated centers for these patients, and the staff there has been provided with the personal protective equipment, all of the standard type, and they have all the protocols with them, the guidelines. So whenever any patient walks in, so they go according to that, and if the samples are to be taken, they have to be sent to the National Institute of Health for screening and all sort of things.
Well, that's great. So it means that the apparatus is in place.
Yes.
But how does it look? Do you think that in the last few days that the graph has gone down, or do you think that it is still going up and that people are not taking all the precaution measures the government has stated them to take?
Actually, people have not been sensitized to these kind of pandemics or you say isolation kind of.
Exactly.
We are a society where we like to interact with the people. We do not abandon even our elders. We don't send them to nursing homes or something like that. We keep to our family systems intact. So social distancing as what is required at the moment now is, although the people who are educated and they have adopted to that, and the government structure is also forcing it also at every level, even with physical punishment sometimes, but although that is not required. But the thing is that the most intriguing problem which is we have come up with, that is the literacy rate of our population.
Yes.
with less than half of the population being illiterate, these messages are being difficult to disseminate.
Exactly.
Although the media and the Pakistan television, everybody has been trying their best to convey to everybody that they should keep the social distancing and whatever is required to keep yourself safe.
Exactly.
And when to approach the hospitals, when to wear the masks, everything.
Yeah.
But still, we have a lot to do.
Exactly.
And the number of the patients still rising because the testing capacity of the government is still needed to expand.
Exactly.
At the moment, Pakistan has reported about 4,000 plus cases, which have gone in a sharp increase in the last 4 or 5 days. A steep rise because of the test results coming up and the people are showing up which have been exposed to some patients.
Yep.
They're coming up for testings. And in Islamabad, we have about 83 confirmed cases today. And yes, this number is going to rise till the time because our testing facilities increase and people get aware of that, and whosoever has been in contact with anybody who has traveled abroad or who has been in contact with the patients, secondary contacts, and because the local dissemination of the virus is coming up. So
all right, and we really need to be careful about it. Yes. So ladies and gentlemen, you've heard it from the horse's mouth as well, but not just that. I think that there's one thing which I really need to talk about, and that is that since I was traveling abroad myself, I made sure that I was in isolation for more than 14 days, looked for all the symptoms, and then made sure that I'm going to work so that I do not affect other people. And I think that this is the kind of literacy we're talking about so that people understand. But in all of this, you know, there were 4 times that I got a call from the Army COVID-19 Center as well, and they kept on asking me, sir, whether you have symptoms or not. And since I didn't have any symptoms, and they were like, okay, sir, stay blessed. I think that everybody's trying to keep a check, but ladies and gentlemen, obviously it does get difficult as well for the authorities if we are not going to take all the precautionary measures. But other than that, Professor Saab, coming on to you now. Now, when we talk about this disease itself, you know, when we sit in front of the television, now for anybody who will be in front of the television, they really need to be scared about it. But that's not the way to go about it. Because earlier people knew only that it is affecting their lungs. But now, as of, you know, because I've shared that research or that article from Scientific America as well, which says that out of every 5 COVID-19 patients, 1 is dying because of heart failure. Why is that so?
Bismillah ar-Rahman ar-Rahim. Shahzad, thank you so very much to put me in your list of friends, first of all. So I'm very honored for that. Remember one thing, this body is not a sole apparatus. All bodies connected, and particularly cardiopulmonary system is very well connected.
Yeah.
And of course, every organ has to get its circulation.
Yeah.
Every infection travels in circulation. So the study you were mentioning about, it's a well-known fact. This virus is not new.
Yeah.
The morphology is new.
Okay.
We have this virus, which is influenza virus family and all that.
Yeah.
Because it's our respiratory system affected virus. Every viral infection can have what we call myocarditis, inflammation of the heart, because that's how the infections work. Okay. Because there's a lot of response of the body to every invasion of the system. Yep. So I have treated back in US and in here, which were viral myocarditis, cardiomyopathies, to the point that many patients were put on transplant list. Okay. Oh yes, of course. I have a patient, her ejection fraction, the function of the heart was only 10 to 15% after just simple upper respiratory infection. So this is not something new. It's a known fact that the viral cardiomyopathies are a true, entity. So now because this virus affects your system, particularly the lungs, and the lungs are not unrelated to your heart.
Exactly.
Because this is so connected, one affects the other, and vice versa. So if people are dying with, this is a concomitant, perpetuate effect of both systems.
Okay.
That's just talked about, and you asked about the ventilator, and I have a different take. I really don't know, for many days I've been saying this, why we had so much emphasis on how many ventilators we have. I couldn't find any data as we were talking earlier.
And then there's a reason, so I'll tell you the reason. So, for example, I just mentioned that I was traveling, so I was in England then, and every time Boris Johnson came up on screen, he spoke about ventilators, and that there are local companies which were making more ventilators. And I think that this theory actually came from China as well, that they required a lot more ventilators because people were dying, and they said that the reason for people to die was the lack of.
And there was no data of survival.
Exactly.
The people who went down to the ventilators.
Yeah.
Now, why this point is important?
Yeah.
The point is important because our emphasis on how many ventilators, functioning ventilators we have, rather than the point should be how much primary care we are following.
Exactly.
The preventive.
Yeah.
The one you alluded to right off the bat.
Exactly.
That's the reason I always raise this question wherever I go. Please stop this, because secondary prevention is gone case.
Yeah.
And I give you an example. From the cardiac point of view.
Sure.
We have a heart failure, stage A, B, C, D. Many people are not familiar, even with your cardiologist, because they still use the old terminology. If you're at stage A, there's no morphological changes in your heart.
All right.
There are no symptoms in your heart, because a lot of discussion being talked about asymptomatic patients.
Exactly.
So you are in heart failure without any symptom, without any structural change in your heart. So if you miss that point, if you miss that stage, the patient is going to progress into stage B.
All right.
Now you have symptoms, and now you have structural changes in your heart.
Okay.
So now you're a true heart failure.
Okay.
So what's the point? What's the take-home message? We have to find those asymptomatic patients before they go from stage A to stage B.
So let's sort it out right now. How can we do that? I mean, a normal person who's at home, who might not have ever had a heart disease initially, or probably in his or her life, how do you think that they can pretty much check by themselves so that they can actually go seek for doctor's help?
That's where the government
Okay.
comes into play. The education.
All right.
You must have been. You go to England, United States. You will see a big billboards.
Yeah.
Hypertension, for example,
Yes.
is a silent killer.
Yeah.
Have you seen here in Pakistan?
Never.
No education. So unless, as Dr. Saab was saying, that we have to bring people up to par.
All right.
Particularly, 60% of the population is where? In rural areas,
Yes.
right? How are we going to educate? Educate doesn't mean that you just go to school, you have gone to college, and you're educated. No,
Exactly.
awareness is very important. And the current pandemics is something so somber, so new times, that the only thing which will prevail ultimately is the education, that awareness, what Dr. Saab was talking about.
Exactly.
Until we tune these people up to that, no ventilator, no hydroxychloroquine and chloroquine.
Yeah, I wanted to talk about that as well. Is it
not
very
gonna
useful in the treatment?
No.
But people are recommending that everybody needs
I
to
know,
use
but
this
you
as
know
well.
how this came up?
Yep.
Dr. Horowitz in Lenox Hill, he cited a study which was done in 2005. This study was on primitive cultures,
Okay.
not on human,
All right.
where they use this, and they have two theories. They came up with the two proposed mechanisms how this can be effective.
Yeah.
And then President Trump just took that news and just ran away with this one.
Yeah.
The FDA came out right off the bat and they said, no, this is not the truth.
Okay.
There's a one guy who took chloroquine and he died.
Yeah.
Every third person or fourth person in Pakistan is what? Hepatitis patient.
Exactly.
Chloroquine is very injurious.
Exactly.
Kidney failures, other problems which chloroquine can have a problem with.
All right.
Like in cardiac patients, it is known fact that the chloroquine, hydroxychloroquine, azithromycin, they can have dysrhythmias. Point is, there's one ventricular arrhythmia,
Yep.
which can trigger a chain of arrhythmias
Okay.
because of the prolonged QT interval, if you look at the ECG.
Yep.
And chloroquine is notorious to cause that.
All right. And I will pause you over here and I'll move back to Dr. Minhaj over here. So how are we treating the COVID-19 patients over here in Pakistan? Are we using the same medications, or do we have some other apparatuses in place, or do we have other techniques or other medications to give to other patients as well?
What
Or are we using the same medicines?
We are basically treating them symptomatically.
Okay.
The first and the best is to just to quarantine themselves at their own places.
So God forbid if somebody's got coronavirus, all they need to do is just stay at home.
Stay in isolation.
Okay.
Don't come in contact with your family. Don't come.
Nobody.
Your utensils will be separate and all. If you develop symptoms which get worsening, then you come to the hospital.
Okay.
And then we
the
treat you
severe
for
symptom conditions are that you cannot breathe.
you cannot breathe.
Fever.
Yeah, high-grade fever, severe body aches,
Okay.
which can so discomforting that you cannot move. You have to cry in pain, something like that.
All right.
Debilitating kind of thing.
Okay.
Those are the symptoms which then you can come to the hospital, get you admitted, and we treat you symptomatically.
So no, but that's fine, and it's right of you to say that you will be treating us symptomatically. That's fine. But are we using the same medicines Dr. Saab is mentioning about?
No, we are not experimenting.
Or so then how are we treating the patients? That's something which we need to know.
That is what, if they have respiratory symptoms, then of course we are treating them according to that, which medicines are required to support their breathing.
Yep.
Or if they have getting a heart condition, then of course on the lines where the cardiac patient should be treated.
All right.
And for painkillers, but not non-steroidals, because we have some studies in the loop that the non-steroidal anti-inflammatory drugs, which are painkillers also, they make the symptoms adverse.
Exactly.
So we are trying to avoid that. We are going on simple things like paracetamol and those kind of compounds.
Exactly. Thank you very much for saying that. And Dr. Saab, that's the same question which I wanted to ask, that, a lot of people are saying, a lot of doctors are saying that we are not really supposed to take painkillers and it is going to have adverse effects on our body as well and the disease. Why?
Do we really know that?
Dr. Saab is saying that.
This
Dr.
is
Saab sitting right next to
I
you.
understand.
I cannot even challenge that.
I understand.
Yes.
But do we really know that? We know in flu, you take non-steroidals.
Yeah.
This is the same virus with different morphology and different structure. So in China, they have used steroids.
Yeah.
We use here too, because what happens when this virus is cytotoxic.
Okay.
It injures the cell. That's how the lung injury comes into play.
There you go.
And we do, as Dr. was saying, that we do everything, oxygen, and if they have to go on ventilator to support their, and of course diuretics, steroids, and painkillers for the body aches and myalgia. Basically it's a myositis.
Yep.
It's a muscle pains, So anything at that point to relieve the fever and the pain can be used. We don't know, that was the talk we were just having there. Many people who are so-called experts on this one are not experts, even in the most elite countries in the world.
Yeah.
Where the
We have
science
seen that.
is that. Because we don't know much about this virus.
Yeah.
These are all anecdotal findings from the other viruses of the same family.
All right.
That this is a totally different virus. So how we treat, as Dr. was saying, the symptomatic treatment, first oxygen, isolation, oxygen, painkillers, narcotics,
Yeah.
Diuretics, steroids. So make the patient comfortable, oxygen of course,
Yep.
and make sure it doesn't go beyond. Another point in the same relevancy, do we know, because there's debate going on, once the lung injury occurs, will they ever recover?
Yeah, that's
That's
something I
another
wanted to
question.
ask.
Because once the cells are damaged, can they recover? Many people are proposing that they'll be scarred for good. So they'll be having a debilitating disease even if they recover.
Okay.
If you look at the press conference by Governor Cuomo in New York, where this is playing havoc,
Yeah.
he was saying that the studies have shown the people who went, not studies, actually the observation,
Yeah.
have shown the people who went on to ventilators for 20 to 30 days, they never made it.
All right.
So that's another problem. So I think the crux of this whole discussion is, as Dr. was saying, isolate yourself.
Exactly.
Listen, give your ears to the information government is trying to tell you, the doctors are trying to tell you, the anchors are trying to tell you. Be aware.
Yeah.
Stay isolated. You mentioned about this hunger problem. Will you be happy with the 2-day hunger or death?
I think I'll be happy to stay hungry for more than 5-6
Exactly.
days, even if that's how
Nobody
the condition
dies
is, God
even with the
forbid.
2 weeks.
Yes.
But this is different times. So I understand this is a social problem. I do understand. Well, I don't want to sound corny and just callous. But these are different times. In one of the programs, I said that so-called the new sociology, we're getting bored at home. So in West, what they're doing, they're having picnics on their balconies.
Rooftops, yes.
Ask those Italians,
Exactly.
where 16,000 people are dead. Ask the Venezuelans and Colombians, where the body is sitting there on the street for 6 days and in home 6 days. Ask those people, are they bored? Do they want to have picnic?
Yeah.
So we have to be very, very sensitive to these matters because entire world is facing something which is totally different. This is a social as well as humanistic and a medical problem.
Exactly, and you very rightly said as well. But sir, very quickly before we wrap up this segment, obviously we need messages from you too as well. But there's been a debate over the serum plasma treatment as well. Do you think that it's going to actually help people? And do you think that people will recover and that it's not going to leave a scar on the lungs as well? Or do you think that the lungs will heal 100% back to normal?
But right off the bat, the short answer is we don't know.
Okay.
Yes, it had been used in the past, so this is not a new theory as well.
Okay.
But even those, there was no controlled studies.
All right.
And I have said this over and over again, that the so-called experts and in emphasizing and giving kind of advice, therapeutic advice, is very wrong.
Exactly.
It's very fake. It's very confusing, and it's like putting a Band-Aid without slicing the abscess.
Yeah.
The pus is still there, you just put the Band-Aid. We don't know because there's so much involved. And I propose in one of the programs, it's the government who should collect, not people like me. I'm a cardiologist.
Yeah.
People, virologist, immunologist, hematologist, infectious disease, make the committees, let them look through the entire data, the entire situation, and come up with their opinions. Because there's no expert in the world, as I said before, because this is something new. Yes, we still use serum, but there's anecdotal findings again. There's no controlled studies.
So right now we don't know.
We don't know, but there is definitely a prospect.
All right.
That we're going to use serum and it may be beneficial.
And it may be beneficial. And ladies and gentlemen, we're definitely waiting on more studies to be done or more people or more cases to come up so that we know for sure. So I think as of now, for anybody who's actually going to opt for such a treatment, that'll be your choice totally. But Dr. Minhaj, very quickly before we wrap up the segment as well, and that is, what are the most common underlying medical conditions people are living with? And do you think that those underlying conditions can have a very fatal effect if people get positive of coronavirus 2019? And what are those conditions? For example, people living with cancer, lower immunity systems as well. So what are the other diseases?
Mostly the lung diseases, because it damages your lungs the most, and of course the cardiac diseases. And whatever, if you are taking immunosuppressants, if you had a transplant like that, you are immunosuppressed already due to medicines, or if your immune system is not working due to some other condition, of course you are at higher risk.
All right.
And one major contributing factor to bring your immunity low, and especially your lung susceptible to get yourself diseased, is smoking.
Yeah.
That is the factor which we have been ignoring.
Oh, yes.
That because of, you remember, there have been cases of lung injuries associated with electronic cigarettes and vaping, EVALI. That was electronic cigarettes and vaping associated lung injuries in the start of 2019. So many people died. And then there was a surge in the cases of influenza in the late 2019. And perhaps the COVID is also a sequelae to that lung injuries. And if we are vaping or we are using shisha and we are sharing the things, and if you recall the precautionary measures which we are promoting these days, that wash your hands and you keep yourself clean and don't touch your mouth or nose, because and the cigarette is the most common thing which you take from your own hand to your mouth.
Yes, exactly.
And you are transmitting viruses to yourself. And electronic cigarettes and the shisha things, most of the countries in this region, they have already banned. Pakistan is one of them. We are not allowed shisha smoking. But still we have to, if we want to protect ourselves, then we have to curtail down our smoking habits also.
Exactly. Thank you very much, gentlemen, for being with us. It was lovely to be in conversation. It was lovely to get first-hand information, then disseminate for people who are out there as well. But But then, ladies and gentlemen, we do have a deep understanding that, you know, that this very channel of ours has got a very limited audience to people who actually understand the language itself. So if you've understood or if you have taken something away from us, please make sure that you share it with other people as well, may it be on your Facebook, social media, or if there are people within your homes as well. Please educate other people, because in this time of need, I think everybody needs to be needful and helpful then at the same time, so that the balance is being maintained as well. Thank you very much, Bhatt sir. Very kind of you for taking our time. Thank you very much, Deputy DG Health as well. Ladies and gentlemen, with that, we're actually going to head out towards a short break. But when you guys will come back, for the very first time on our show, we'll actually have a molecular virologist who's actually going to let us know what this virus is doing to ourselves. And then we'll do a little bit of myth busting, as in, for example, surfaces like wood or clothes. How long does the virus take to stay on it? And then how do we actually get rid of all of those things, or probably all of these surfaces? How do we clean them? And then how can we treat ourselves as well? Ladies and gentlemen, that's the kind of conversation we're going to have. Please make sure that you don't go anywhere. We'll be right back. Good morning.
Magla Hills, the heaven of Islamabad. The abode of God, a place where you can explore your soul and meet power of natural elegance of mountains. Spread over an area of 12,605 hectares, the Magla Range, the foothills of Himalayas, are youngest hills with an age of 5,000 years old. Magla Hills are home to around 600 plant species, 250 bird varieties, 38 mammals, and 13 species of reptiles. Magla Range is characterized by many valleys, scenic spots, and beautiful water streams, especially in the monsoon months. Famous for their tranquil environment and lush green natural splendor, Magla Hills are a particular source of pride, harmony, and spiritual solace. For the residents of Islamabad, many of whom make it a weekly ritual to scale the various trails to Damaneko and Pir Suhawa. Magla Hills send off its visitors with lasting trail of memories to relish in solitude and provide an escape from the relentless rhythm of life.
All right, ladies and gentlemen, welcome back. For everybody who just got tuned into PTV while you watching well this morning alongside Shazad Khan. Ladies and gentlemen, earlier we were in conversation with the cardiologist and then Deputy DG Health over here in Islamabad as well. I think that the preparedness did definitely look good, but then at the same time, we really need to take precautionary measures. But other than that, before going towards the break, I told you that, you know, we're going to have such a guest for the very first time on our show, because she, ladies and gentlemen, is the only molecular virologist over here in Pakistan. And the best part of it is that the sole reason why I'm smiling is that even to my knowledge, this field itself was very new, so I kind of digged in, I was searching for it, and all I could actually tell you, or all I can share with you, is that it is actually the study of virals on a molecular level. I think that's what it is. But ladies and gentlemen, we are going to hear it from the expert herself as well. Ladies and gentlemen, we're very lucky that we've actually been joined by Dr. Zarina Hassan as well, who is a molecular virologist. Hello, assalamu alaikum. Good morning. How are you?
Good morning. Good to be here.
Thank you very much for joining us. And ladies and gentlemen, all of these paintings we have over here are actually made by her as well. And not just that, she's a trekker too. But ladies and gentlemen, let's get the conversation started, because we're left with very short time. So Dr. Zarina, please let us know about who molecular virologist is, and how do you think that this study is relevant in these times of pandemic?
I do miss not being on the front lines. Molecular virology is the study of viral genetics. Okay. In essence, how a virus replicates, how it invades a host's system, how it evades the immune defense of the host to propagate itself. So, it's a fascinating field. It has implications in the field of agriculture as well, not just medicine, and especially what drew me to it was the fascination that you can use viruses as vectors to combat cancer and oncogenesis. So, yes, it is very relevant. The only correction I like to make is, to the best of my knowledge, I am the first molecular virologist of Pakistan, but certainly not the only one. So, I'm sure many have followed suit since then.
Which is why, ladies and gentlemen, I said that she's the first and the only one who we have had on the show. Well, that's great. Okay. But now let's talk about this virus itself. And because earlier in the first half of the show, we had a very apt cardiologist, and I'm a big fan of his as well. But he told us that, that these viruses have been around. What's so different about COVID-19, and why is it having an impact of such sort on everybody?
Coronavirus is a family, and the reason it's called corona is because these particular viruses have a crown, so to speak, of glycoproteins sticking out, spikes sticking out of their shell, which gives it its name. And it's the same family which we saw SARS outbreak, MERS outbreak. So, COVID-19, the CO is for corona, VI is for the virus, D is for the disease, 19 is that it began in 2019. That's the story behind it. It's an RNA virus. The silver lining is that although it's highly contagious, it's a very fragile virus. So, a simple act of proper hand washing for 20 seconds with soap and water is enough to literally wash it down the drain. Another silver lining is that it goes easy on children, which is something we should celebrate.
Exactly. Now, this is something to celebrate, but I think that this is something we really need to be careful about as well, and it's because of the fact that while I was studying about COVID-19 as well, it said that it's R6, which means that it can be spread to 6 other people as well. But ladies and gentlemen, babies or children are actually labeled as super spreaders, and it's because of the fact that the parents might not know that their kid is actually positive of coronavirus because he or she is not showing any symptoms. The mother cuddles the baby, the mother is infected. So I don't know whether it's a silver lining or we really need to be more careful, because kids these days, they are playing together, whether even inside the house as well. So how do you think that anybody can actually get out of it? Do you have solutions for people who are actually fighting with COVID-19 in these days?
It is a pandemic that we are experiencing, and again, there's drawbacks and there are advantages of the time period we're living through. The drawbacks are because the world is shrinking quite literally because of travel and trade, and it's difficult to control an outbreak when there's human-to-human interaction, and plus this virus is changing form on a daily basis because it's evolving, it's under pressure, it's going to devise new strategies to evade and escape the immune defenses that the human body comes up with. It started off being transmitted from animals to humans, progressed from humans to humans, and then the scary part in the life of any virus is when out of nowhere people seem to be getting infected with no obvious contacts. So there's a lot we do not understand. That is why we cannot afford to lower our levels of vigilance. But having said that, as I said, the good thing is that it is fragile. So if we take the necessary precautions, And hygiene, personal hygiene is something, these habits, if are they to be inculcated, they should be followed through even when the outbreak is over. But the contacts and the cases have to come down to zero.
Yeah.
There is no other way. There's no question of being passive about and taking comfort in the concept of herd immunity. You'll hear all sorts of studies cropping up from everywhere, but it is, or realistically speaking, 12 to 18 months is the time period for any vaccine to be developed against any virus, and this is a new one.
So all we need to do is take precaution measures and make sure that we stick to them as well. But let me very quickly ask you that there's been a longer debate on people saying whether it stays in air or not, whether is it in water or not, or whether can it stay on surfaces like wood, clothes, and if it do or if it does, what we really need to do is that we really need to know how long, so that we can actually put our clothes somewhere outside, then let them be under the sun and then probably send them for a wash. So please, can you share a few details?
Common sense has to, take the front seat again. As in normal day-to-day life, yes, sun is a good of disinfecting, proper hand washing, avoiding interaction, unnecessary interaction. But having said that, again, I'll reiterate that COVID, that will give us a slight edge as long as the contact is reduced and dissemination is reduced. It's a fragile virus. It does not stay on and on for weeks or months on end. And again, to be cautious, it is destroyed at 56 degrees, but that is again living in a fool's paradise, thinking that come summer it's going to automatically disappear unless we're going to be scorching in an oven or in a desert somewhere. Our temperatures do not hit 56 degrees.
Thank God, otherwise we'll be melting anyways.
And it's happening in phases.
So then people won't be dying of coronavirus, people will be dying of because of the hot weather outside.
And it's happening, it's spreading in phases. So it takes 6 to 10 weeks. When one region is clear, it has been passed on to another. So again, it has to come down to zero. We cannot be complacent about it. Otherwise, there'll be no end.
That's fair, but my question still stands. Does it stay in the air or does it travel through air as well?
It can travel to a reasonable distance. Like in an aircraft, if you're seated amongst other passengers, 2 seats on either side of you is the level of spread of the virus. So it's not if somebody is not going to travel through the ventilation system from the cockpit to the tail. But even normally when I fly, whenever I fly, the minute a hot towel comes, if I have wipe in my bag, the first thing I do is disinfect the handset or my armrest or the meal table. These are precautions I take even normally, and these are something we have to make part and parcel of our lifestyle, and we have to respect nature. We have to stay close to earth, not abuse nature, do not push nature to fight back. That's when viruses evolve, and they cross the dimension from the animal world to the human world, which is called zoonosis in technical terms.
And even listening to zoonosis, ladies and gentlemen, it makes me feel a little I don't know what the kind of word I need to use over here, but I think I feel a little disgusted that this has happened, that it has traveled from animals to humans, and I don't know which human was it that who actually went out to the animals or probably ate the same animals, but I think that it's not a debate we need to be involved in anymore. But very quickly, because we're only left with 5 minutes, and I need to talk about these paintings as well. Very quickly, one last question about COVID-19, and that is, what are the maximum kind of precautions people need to take, and then stand by it, and that's it?
Frequent hand washing, avoid crowds, avoid closed spaces, keep the social distance as being advised, because you can be a carrier for a good 24 days and not show symptoms.
24 days?
Yes, it's the incubation period for COVID-19. So it's a long stretch.
So the only thing we knew was that we actually have to be in isolation for 14 days, and that's about it. So now it's
the incubation period for COVID-19 is 24 days. And another concern that I have is, given the economic crunch and the pressure and the social pressure we're in to be mentally fit, to be physically fit, my apprehension is that the quarantine will be lifted prematurely, and then all the time invested into this is going to really amount to nothing. So the caution level cannot afford to bring that down. I don't see it disappearing, quite honestly, for the next 6 months.
And we definitely value your concern as well, and I think, ladies and gentlemen, with that everybody's on the same page. And I think that so far the reports which has come out, even World Health Organization has said that Pakistan is actually taking a lot of good precaution measures, and that it will actually help to reduce the number of people or patients in a longer period of time. But then at the same time, as Dr. Saiba has said, that we really need to take all the precaution measures and make sure that we stay in a lockdown, or even if it's not a lockdown, people need to be in their incubation centers as well, or quarantine yourselves at your place or places, or be in isolation. That's something which is very important. Make sure that you wear masks or gloves, and whenever, God forbid, if there's any necessity and that you have to go out, please make sure
And
that
a final point, if
Yeah,
I
sure,
may,
sure.
do not victimize the patients and the cases either. I think that's very important to highlight
Exactly.
as well.
Exactly.
Do not victimize people who have, contracted.
I mean, I don't think
the
that anybody
disease.
would be victimizing, but then at the same time, ladies and gentlemen, I think that that's a valid point as well. But very quickly, for somebody who's a molecular virologist, and she paints too as well, and then, ladies and gentlemen, I was surprised, and it's because of the fact that she cannot see now. She used to, but now she cannot see. So how did you do this? So I'm holding one of the painting, it's in my hand, and you can let people know. How did you manage to do all of this?
I don't know which one you're holding.
So I'm
but I
holding a
brought the
blue one with black frame.
Yeah, the ocean or the lady by the window.
It's the lady by the window.
Yeah, so it's, I think I found expression through art. Once I lost sight, I had to recreate life from scratch, and I think this is a follow up of that process. I started painting in 2017, having lost sight in 2015. So I had so many memories. I still have such beautiful memories. They had to find a way of expression, and it gives me a chance to connect with the sighted world, and it forces a conversation as to not to dismiss me or anyone in my position just because one part of my body has stopped working. My spirit is very much there. And plus I use my art for fundraising and to speak about causes that are very close to my heart.
Yep.
I'm working for creating a resource center for visually challenged students and professionals.
Exactly.
Who can use technology, and with technology can be the equalizer. There's no reason why it cannot be an inclusive society.
Wow, it's wonderful, and thank you very much for saying such wonderful things early in the morning as well. Thank you very much, Dr. Saiba, for being with us, and you've definitely done a tremendous job. But first of all, being the first molecular virologist, and then painting without eyes too as well. I think, ladies and gentlemen, this is something which everybody needs to take inspiration from. All of these things, these pandemics, they've always been a part of life, and they will always be in future too as well. All we need to do is be prepared and take all the precaution measures which are important. People who are still thinking that it's not going to happen with you, please make sure that you do not think this way. This will be very ignorant of you. This virus is not going to leave anybody until and unless they take all the precaution measures which have been stated and said over and over again on television as well. Thank you very much, Dr. Saiba, for being with us.
Having me.
It was wonderful of you to take our time. Thank you very much, DG Saab, who was with us as well, and thank you very much, Bhatt Saab, an amazing cardiologist and a professor, ladies and gentlemen. I think that every day when I wake up, even I have an underlying medical condition, I make sure that I'm going to be the frontline warrior, and it's a choice, and I take all the precaution measures. But then at the same time, if you want to be a hero in this time, you can be a hero by staying at home. I think that's the message which we need to deliver. Please make sure that you write to us on our Facebook page, which is with the name of World This Morning. On Twitter, it's World This Morning without a G. On Daily Motion, it's World This Morning. On YouTube, it's PTV World, and then you look for World This Morning as well. The repeat's going to be at 11 p.m. tonight. Till the next time, look after yourselves, stay blessed, and we'll see you tomorrow. Good morning.